What's up, TikTok? I'm Dr. Jamo. I'm a board-certified cardiac anesthesiologist. Let's answer this question for you real quick. I just need to change. Okay, so this is exactly how I would explain the experience if you were coming to me for this procedure. Hi, I'm Dr. Jameson. I'm going to be your anesthesiologist today. Looks like we got to do some plumbing today. Is that right? I think we're doing an aortic valve replacement, correct? So here's how the anesthesia works for that procedure. You're going to be under a general anesthetic. That means you're going to be totally asleep. What we're going to do is we're going to get you back to the room, help you onto the table, hook up all the monitors. At that point, I'm going to use a little bit of medicine in your IV that'll help you to relax quite a bit. Before you go to sleep all the way, I'm going to start a special IV in your wrist right here. This will help me to monitor your blood pressure. Every time your heart beats, a blood pressure reading shows up. Once that's in, you're going to go to sleep completely. I'll use a breathing tube while you're sleeping to help you to breathe and protect your lungs. I administer an inhaled anesthetic through that tube that will keep you asleep throughout the procedure. At that point, I'm going to start a special IV in your neck that will allow me to monitor the pressures inside your heart. I'm also going to be doing an ultrasound of your heart, or an echocardiogram. I do that with a special probe that goes down in your esophagus and sits right behind your heart. I can take some very detailed images of your heart throughout the procedure. So at this point, we actually need to do the surgery that we're here to do. And to do that, we need to put you onto the heart-lung machine, which means we're going to stop your heart, we're going to stop your lungs, and that machine is going to take over the function of your heart and lungs. To actually do that, we need to stop your heart from beating. And we do that with a medicine called cardioplegia. And the main ingredient in that medicine is potassium, which actually suppresses the electrical activity of your heart. We do the operation, and when we're ready to start your heart back up, all we do is we wash out that cardioplegia, all the potassium comes out, and your heart naturally will start beating again. Sometimes we have to use some additional medicine in your IV to help it beat stronger or faster or things like that, but it will start beating on its own once we take that potassium out. At this point, we close you up. We're going to take you to the ICU. You'll wake up in the ICU a couple of hours after the surgery is over because I've turned off that inhaled anesthetic. Again, that's a natural process that occurs as your body gets rid of that inhaled anesthetic. Once you're awake, breathing tube comes out. The other lines, the one in your wrist and the one in your neck, come out usually over the next 24 to 48 hours after the surgery is over. And that's basically it from my standpoint. Let me just change again, get out of these PJs. Okay, so at this point, I'm going to answer any additional questions the patient might have about that process. So if there's anything you want clarification on, put it in the comments over here and we'll get it answered.